first thing to do when you will treat a lesion on the human body is to assess the lesion. Which kind of lesion is it? Is it surely a benign lesion? And then assess how deep it will be. For treatment of warts, for example, which can be more deep until 3 millimeters of depth, you will have a treatment extending to 15 seconds, then stop for 30 seconds and do a 15-second treatment again. To be very effective, as soon as the patient indicates that it started to sting and to hurt a little bit, the doctor will know that he reached the bottom of the wart and he touches the healthy tissue, so he knows that he reached and he can stop the treatment of the first freezing. After 30 seconds he will do the freezing again, and the patient will indicate when he will reach the healthy tissue, because it will start to hurt a little bit. But so this is the fact that with this CryoPen you're very effective in the treatment, because it will only take you 1 session to have it completely removed. First of all, the temperature of the liquid. Liquid nitrogen is minus 196 degrees. Okay, very aggressive, but okay, and still a common practice today. But in fact, it's too aggressive for the treatment of the benign skin lesions. CryoPen uses nitrous oxide at minus 89 degrees at a constant jet of 55 bar, penetrating the skin, as said, 1 millimeter every 5 seconds. So this is the biggest advantage of using nitrous oxide in this technology to liquid nitrogen. Liquid nitrogen will never be as precise as you will be able to treat only the lesion with this. It's less aggressive with nitrous oxide, but more than enough to achieve the cryonecrosis in your cells, and it will be able to vanish in 1 session, which will not be the case normally with liquid nitrogen, which will hurt the patient more because you're not as precise as with this microjet, because you will also touch the healthy tissue around the lesion. The fact there is no risks to it. You will have no cuts, no bleeding, no risk of infection with this technology. In fact, it's a very natural process of killing the damaged tissue on your body, and with a very effective and very good outcome. Yeah, one of the biggest also segments where CryoPen is used is indeed in the veterinary segment. Why is that? Because just the fact that you're able to treat so precisely on the lesion itself, also for animals, it's a very practical way to treat them, because you will not have aggressive reactions from the animal towards the doctor when treatment is done.